Thank you and good afternoon. We're continuing our briefings over the weekend to update you on the progress of what's happening and the continued actions and steps that are being taken. I want to say a special thank you to Jeff and all of our folks who are staffing our Emergency Operations Center, who are working incredibly hard to try and make a difference and make sure that there is broad-based communication and coordination between all of our sectors and all of our agencies and all of our entities, and we really appreciate their work that they're doing. Yesterday, I walked through the governor's new executive order related to his stay-at-home directive along essential services. Between the time that order was issued and today, our county and others have been working closely with the governor's office. I mentioned yesterday that there would be further clarification and guidance from the governor on what is essential services that should remain open. You can look at the entire 14 pages that they put out today to provide additional guidance and clarity. If you go to covid19.ca.gov, they have a full listing. I want to briefly outline a few key groups that residents and employers should be aware of that are further outlined in the governor's state action, and these apply for the entire state of California. They clarified restaurant carry-out and quick service food operations, including food preparation and delivery food employees, are essential critical government workers as defined by local agencies to ensure continuity of government operations and plans. County workers responsible for determining eligibility and safety net benefits. Workers supporting public and private child care establishments, pre-K establishments, K through 12 schools, colleges, and university for purposes of distance learning. Provisions of school meals or care and supervision of minors to support essential workforce across all sectors are exempt. Construction workers who support the construction, operation, inspection, and maintenance of construction sites and construction projects, including housing construction. Commercial retail stores that supply essential sectors, including convenience stores, pet supply stores, auto supply and repair, hardware and home improvement, and home appliance retailers. Workers that provide or determine eligibility for food, shelter, in-home supportive services, child welfare, adult protective services, and social services, and folks who provide necessities for the economically disadvantaged. Legal or accounting services which are necessary to assist in compliance of legally mandated activities and critical sector services, and faith-based services that are provided through streaming or other technology. We will continue to work with the governor's office and the administration as we all seek to continue to get further clarity and guidance on essential services and employment that should remain open. We have been working very hard with the city of San Diego, with other cities, with the Regional Task Force on the Homeless, on efforts surrounding the unsheltered. Our public health nurses have now expanded to be present in 9 different shelters: Alpha Bridge Imperial, Alpha Bridge Newton, Golden Hall, Haven House, La Posada, Operation Hope North County, Rachel's Women's Shelter, the San Diego Rescue Mission, and Veterans Village of San Diego. Now all have public health nurse staffing to screen the residents of those shelters to identify potential symptoms, and if they see those symptoms, to immediately remove them for further evaluation and consideration by higher level public health experts. Our public health nurses have expanded to 8 homeless outreach teams. We have, as we've outlined a number of times, public health motel rooms. We currently have 1,783. These are rooms for individuals who have a positive test, are a person under investigation, or unique categories of individuals with symptoms who are awaiting additional health screenings. I think it is important to let the public know that as we see a potential significant increase in testing in the coming week, we are likely to see a significant increase in the number of positive tests, and the need for these rooms could become exponentially greater. And so we will continue to monitor the situation along with our rooms. We had previously allocated 100 of these rooms to the Regional Task Force on the Homeless for unsheltered individuals who were seniors or had underlying health conditions but did not show any symptoms. As they have proceeded with filling those, we have now allocated them another 100 rooms for that purposes. But they are 2 different sets of rooms. One is a category of public health motel rooms, which are individuals positive, persons under investigation, or certain individuals with symptoms. The others are for the general unsheltered, and we will continue to work with those. I remain concerned about the lack of social distancing capacity in our homeless shelters. and we are working with the homeless shelters along with the City of San Diego and the Regional Task Force on Homeless on actions that we may take to try and address that and provide more sheltering opportunities. And we hope to have more substantive things to report perhaps as early as tomorrow. This was alluded to earlier, but there is a broader concern that we share about the overall mental and physical health of our population, not necessarily in direct response to being infected by COVID-19, but by other things that could be exacerbated by the actions we've taken. There is a concern about an increase in potential domestic violence, child abuse, drug or alcohol abuse. We've been working closely with Dr. Luke Bergman, our behavioral health director, on services and support that we can provide region-wide to help ensure that we are staying healthy as a society. We will continue to push out that information as well in the next day or two, perhaps some specific guidance with Dr. Bergman. And finally, I just want to comment on sources of information and uncertainty. Last night, I got a series of frantic messages from folks who said, oh, I heard you can get it from the water. And we've all heard a lot of things, but it's not true. And it really is important in this time of uncertainty and difficulty that we rely on our trusted sources of information. It is really easy to go down a very dark path on social media and on the internet with a lot of speculation and a lot of uncertainty and a lot of folks who aren't in a position to have accurate information sharing that, and that does nothing to help keep us safe. What helps keep us safe is listening to our public health doctors. Dr. Wooten walked through all of the ways it can be spread and all of the things and steps that you can take to try and address those issues. And so we really encourage the public to really rely on those sources. And I understand that we live in a world that increasingly feels at times devoid of fact. But our public health nurses and doctors are not ideological and they're not partisan. They're driven by data. They're driven by science. They're driven by research. And I can assure you that we will continue to provide you with every piece of information we have about the things that you can do and should do in order to stay safe in this environment. The same is true with the numbers and the trends and where it's headed. As soon as we as a county know, we will share that information with you along with all appropriate public health guidance. But it is vital that we do rely on those trusted sources of information. And as things change, we will continue to change. We will adapt, we will find new ways, we will share information. But through this all, I am really encouraged by a lot of the things that we're seeing out there. People coming together in remarkable ways. We launched a community response fund earlier this week, and we are adding almost $1 million a day to that fund. That's encouraging. I was encouraged today that our local labor council, in partnership with a bunch of nonprofits, did a food drive to help families who are in need. They helped over 500 folks, and they decided that, you know what, we need to do this every single Saturday. And they aren't the only ones out there doing it. But there's also individual actions that people are taking. I saw a welder who came out and said, hey, I'm available for any healthcare facility that needs something welded. I won't charge you. I have all my equipment. I'm not working. I'd love to come be a part of a solution if you need it. I was really moved by the story of a bunch of middle school kids who realized that their neighbor was a senior citizen in isolation, and so they took their band instruments and they went in her front yard and they played her a concert. Every single day, through all the uncertainty and difficulty, we see people taking these acts of compassion. And perhaps it took us being physically separated in order to begin to bring us back together. And that gives me incredible hope as we continue to advance through the uncertainty together with the spirit of hope, knowing that we can confront whatever happens. Thank you.